Can you give us a community update before we head into the new year?
Yep, so for December 30th, 2020, at roughly 2 o'clock, this is the data for KFL&A Public Health. And just to let you know, we together with our assessment center partners, our lab partners, have been monitoring this and at work every day, and we will continue to do that throughout the pandemic. We're basically concerned about any effect socialization over Christmas will have, and then secondary socialization of New Year's Eve will have on increasing the rates of transmission. Today, we have 47 active cases. 9 cases did resolve, but we had 10 new cases. And when we look at these cases and speak to them, some of these individuals have traveled, they left our region, they had family gatherings in higher risk environments, and hence that's the biggest threat is anyone that's traveled outside and brought the virus back, and then might have a New Year's Eve party where if they didn't know they were transmitting the virus, it would become another super spreading event. For comparison's sake, our rate of infection is today 17.8 per 100,000, but for Quebec, it's 189, so almost 10 times our rate. For Ontario, we're 1/5 the Ontario rate. Toronto is 146, and Peel's 176 per 100,000. So thank you to the community. You've gotten tested, you're following the rules on isolation and quarantining, and I think we can maintain that low rate, but we can't do it without you, and have to thank you again and again and again. We continue to have high testing rates, a very low percent positivity of 0.6% of all of our tests are positive. So we like maintaining good vigilance through testing. We have no one active with COVID-19 in hospital. We're monitoring around 428 contacts. I'm happy to say the one outbreak we've had at Fairmont with 1 staff and 1 patient will be finished tonight. As well, we had activity of COVID-19 through places of worship. Again, those outbreaks should be finished tonight as well. We made a public declaration of a risk at Rogers Telecom Center at Cataraqui. So anyone that visited from the 17th to the 22nd may have been exposed in that environment. And we suggest you monitor your symptoms and get tested if any symptoms develop. So all in all, as compared to many other regions, we're doing well. But we have to stay vigilant heading into New Year's and not allow New Year's to be a super spreading event. Stay within your household, maintain all of the best practices that you've been doing all along,